Come with us as we explore the mystical effects of anesthetics. When I count to three, you will fall asleep. One, two, three. Whoa, okay, who was that? Sounded like a voice in my head. Did you guys hear that too? Anyways, he was right. We are covering the anesthetics, but not all of them. You see, we've got a lot of drugs in our arsenal to use for anesthesia, but none of them can achieve all of the effects that we'd like unconsciousness, amnesia, analgesia, autonomic reflex inhibition, and skeletal muscle relaxation. So we have to use combinations of various medications, including both IV and inhaled anesthetics. In this sketch, we'll cover the ones that are administered intravenously, and that's why throughout these dank, narrow streets, we've incorporated our recurring symbol for IV administration, that climbing IV. Oh, cool! It looks like a street fair. Huh. Anesthetio. Okay, weird name, but I wonder what he does. It's fall asleep. Hmm. I'm getting a little, Thanks for letting me touch your hair, John Stamos. What? Oh, whew, where am I? That God, that sign is really hypnotizing. Knocked me out like an embryology lecture. Okay, so general anesthesia has three phases: induction, maintenance, and emergence or recovery. IV anesthetics are most commonly used to achieve the rapid induction of anesthesia, so think of this great big introducing sign. You can see our recurring symbol for the GABA A receptor. It's the GABA A cab, of course. This time, it's more of an early 1900s buggy, because at Sketchy, we strive for utmost historical accuracy, based on the history we learned from reading the Sherlock Holmes books. Okay, it was the movies, but in my defense, I was awake for like half of them. Probably. Most of the IV anesthetics achieve their effects through potentiation of the GABA A receptor complex. Since the neurotransmitter GABA has an overall inhibitory effect on the central nervous system, these drugs increase that inhibitory effect, leading to an overall decrease in CNS functioning. On to our first agent, so let's swing on over to Anesthetio to check it out. This delicious looking milk of amnesia will embody the IV anesthetic propofol, the most frequently administered drug for induction of anesthesia. Just think of propofol as that milky white bolus injection that the anesthesiologist will push in order to make the patient propofol asleep. The mechanism of propofol is unclear, but it's thought to work through potentiation of GABA A, so think back to our CAB A. Propofol has a very rapid onset, since it is highly lipophilic and preferentially enters well-perfused tissues very quickly, like the brain, since these tissues are much more lipophilic than blood is. We've shown this lipophilicity with that greasy, fatty burger. And let Anesthetio's fancy hypnotist pose ready to snap his fingers remind you of the fast onset. After the initial bolus, though, it starts to redistribute to less perfused but even more lipophilic tissues, like fat and skeletal muscle, the main volume of distribution for lipophilic drugs. Just like this milk here is redistributing to all the other shelves. Because of this redistribution, the duration of action of propofol is also rapid, lasting less than 10 minutes after a bolus, making it ideal for anesthesia induction, or even short-duration general anesthesia outside the operating room. Luckily, the pharmacokinetic profile of propofol also allows for continuous infusion, like this assistant is continuously refilling this, hypnotea? Hypnotized victim's milk bottle? To make sure he stays asleep. Huh. Thus, propofol can be used for maintenance of anesthesia, either all by itself or in combination with inhaled anesthetics, sedative hypnotics, and opioids. Similarly, propofol infusion is a common choice for prolonged sedation in the ICU. Maybe it's hypnotea after all. Hypnotized victim makes it sound like they have plans for him to do something dastardly. But Anesthetio would never do that. He's a wholesome hypnotist. Speaking of prolonged use, it's associated with high serum triglycerides because, again, propofol is lipophilic and requires a solution high in lipids to stay liquidy. In fact, high triglycerides can be one of the first signs of propofol infusion syndrome, a very rare but often fatal condition where patients develop metabolic acidosis, rhabdomyolysis, renal failure, and cardiac failure while on high, prolonged doses of propofol. Ooh, that looks like a pleasant dream. Thinking about his sweetheart. Anna and Phil sitting in a tree. K-I-S-S-I-N. I'm sorry, I'm like 12. What's not so pleasant is the anaphylaxis he might get if he's allergic to eggs or soy, since that lipid solution is made with egg and soybean products. Much more common and a very important adverse effect to remember is the known effects on blood pressure. Of all the induction agents, propofol produces the most pronounced hypotension due to profound vasodilation in both arteries and veins, reducing both preload and afterload. Just look at our hypnotized victim, hypno-tease sleeves, to see our recurring symbol for decreased vascular resistance, those baggy, dilated arterial sleeves and venous pants. Propofol does not have analgesic effects. In fact, it can cause pain or a burning sensation on injection, hence the pain lines where the assistant is poking him. Lastly, propofol causes significant respiratory depression, symbolized by these collapsed lung balloons. And with that, it's time to introduce our next IV anesthetic, etomidate. Let the fancy Tom out on a date represent the IV anesthetic etomidate, an alternative to propofol for the rapid induction of anesthesia, which you can remember with the big word introducing on the sign as with propofol. And since etomidate appears to act through the potentiation of GABA A again, remember that GABA A cab in the back. Like propofol, etomidate has no analgesic effect. Tom is aware of this, as he's just tried to look cool with a fancy cane trick and instead stabbed himself in the foot. Well played, Tom. Thankfully, his date seems quick with the reflexes and is stabilizing him. Just like one distinct feature of etomidate is its ability to preserve cardiovascular stability after bolus injection, causing minimal changes to blood pressure, heart rate, and cardiac output. This makes etomidate the top choice for induction of anesthesia in patients with compromised hemodynamics or myocardial contractility. In other words, etomidate is hemodynamically neutral. Another important feature is that it inhibits the synthesis of cortisol, leading to adrenocortical suppression. This makes etomidate inappropriate for use in septic shock or for prolonged sedation, hence the falling adrenal-shaped purse. The next IV anesthetic is ketamine, symbolized by our kettle corn stand. Don't look directly into the kettle corn kettle though. It'll mess with your head. Ketamine is presumed to inhibit the NMDA receptor complex, demonstrated by the lack of desserts, inhibiting any fairgoers from, increasing their blood sugar? I don't know, that got away from me. Note that this mechanism is different than the other IV anesthetics, who work through that GABA A cab, but we are still talking about induction. Hey, get a hold of yourself. What did I tell you about looking directly into the kettle? Didn't you hear me the first time? Oh, you forgot. Well, maybe you just ate too much of it. The unique characteristic state observed after an induction dose of ketamine is known as dissociative anesthesia, meaning it produces both anesthesia and amnesia, but both consciousness and respiratory function are preserved. So this lung balloon is floating just fine. At lower doses, this dissociation can be euphoric to the patient, hence ketamine's illegal use as a recreational drug called Special K. Unlike propofol and etomidate, ketamine does have strong analgesic properties, and when combined with its other properties, makes it very useful for conscious sedation for shorter procedures outside the OR. Just calm down, okay? It's gonna be fine. I'm not freaking out. You're not freaking out. Nobody's freaking out! Oh. We're probably just feeling some of the unpleasant reactions that occur when emerging from a ketamine-induced dissociative state, like vivid, colorful dreams and hallucinations that can be visual, auditory, or even tactile. Not surprisingly, this can be quite disturbing to the patient. Instead of cardiovascular depression like most of the anesthetics, ketamine can produce significant increases in blood pressure, heart rate, and cardiac output, so we've elevated this heart watch popping out of this guy's pocket. Gives a whole new meaning to losing time, doesn't it? The increased cardiovascular activity is mediated through catecholamine release, so we brought in some catfish. The release of catecholamines also produces bronchodilation, making this a useful sedative in cases of bronchospasm and in patients that can't tolerate hypotension, like polytrauma patients. Yeah, fried catfish and kettle corn, that's it's definitely a thing, right? I mean, I'm sure it's great. Benzodiazepines, such as midazolam and lorazepam, are also used in the perioperative period. What? Wait a minute, is that? Oh, it is! It's the same Ben's Diner from our benzodiazepine sketch! Wow, it's been here since the early 1900s, huh? Still serving that same old water, I bet. Rife with cholera for that authentic turn-of-the-century taste. Jon Snow best get on that, and I'm not talking about the Night's Watch guy. If you look closely at the water pump outside, you'll notice the uncomfortable resemblance to a scope heading down a bowel. That's because many diagnostic and minor procedures, such as colonoscopy, can be performed without general anesthesia using sedation-based anesthetic techniques. IV benzodiazepines, for example, can be used to induce a state of conscious sedation when the patient is able to maintain a patent airway and even follow commands during the procedure. Check out our Ben's Diner sketch for an in-depth discussion of the sedating and anticonvulsant properties of benzodiazepines. Upstairs, I'd like to introduce you to our last agent used for the induction of general anesthesia, the barbiturates. I want to say last but not least, but they really are least, because barbiturates have been largely replaced as induction agents by propofol, which is why we have them last. Nevertheless, our barber is open for business, embodying the barbiturates like thiopental. Back at our barbiturate barbershop sketch, we called thiopental the Old Quick Shave. That's because it's an ultra short-acting barbiturate used for induction during rapid sequence intubation. Thiopental is highly lipid soluble, so it immediately enters the CNS to take effect. Not only is it quick to act, however, its duration of action is pretty quick too, only about 5 to 10 minutes. Be sure to check out our barbershop sketch for more info. And that's where we'll end this sketch. Let's review. Propofol is used for the induction of anesthesia and is thought to decrease CNS functioning through GABA A receptor complex potentiation. Propofol has a rapid onset and offset due to its lipophilic nature, with its duration lasting less than 10 minutes. As an infusion, however, it can be used for maintenance of anesthesia or even prolonged sedation in the ICU. Adverse effects include profound vascular dilation leading to significant hypotension, respiratory depression, high serum triglycerides, and anaphylaxis due to egg and soy products. The next IV anesthetic we covered was etomidate, which is used for anesthesia induction and also works through GABA A potentiation. One of the most important features of etomidate is that it's hemodynamically neutral, or preserves cardiovascular stability, making it an excellent choice for patients with already compromised hemodynamics. However, it can be associated with adrenocortical suppression. Then we moved on to ketamine, which is also used for anesthesia induction, but instead works through inhibition of the NMDA receptor. Ketamine is known for causing dissociative anesthesia, which includes amnesia. It preserves consciousness and respiratory function, and actually increases cardiovascular function, and has analgesic properties, making it a good choice for short procedures outside of the operating room. Unfortunately, it can have unpleasant emergence reactions, like hallucinations that can be disturbing to patients. Lastly, we mentioned benzodiazepines, as they are useful in the perioperative period as anxiolytics and sedative hypnotics, and barbiturates as a historical mention for anesthesia induction, but are rarely used these days. You know, for some reason, I have this weird urge to go binge watch reruns of Full House. So, yeah, I'm gonna go do that. Stay classy.